So the question is how to monitor patients better who are taking prescribed medications and make sure they're taking them consistently. Well, I mean, there's a couple of caveats to this. First of all, I don't know about you, but I would have trouble taking a Z-Pak, as Steve Pasick said earlier. So, I mean, you know, many of us have trouble taking medications as they're prescribed. So if we prescribe someone an as-needed opioid medication, we have to keep in mind that, you know, people just don't necessarily take medicines the way they're supposed to. And that doesn't mean that they're addicts or abusing it. It's human nature. However, on the other side, these drugs have powerful and significant influences on our culture and have been deadly for people and when they're misused and abused. And we have a responsibility to monitor their use and to do our best to reduce diversion of these medications and abuse of these medications. So one of the ways certainly is urine drug monitoring. And although we don't have a lot of good data to show that this does reduce diversion, intuitively it makes sense to us. Another would be using prescription monitoring programs, which most states have at this point. And those programs, too, are very good. Again, there's very little data to suggest that they actually do reduce diversion, although intuitively, again, we would assume that they probably do. The other thing is to do a full evaluation and history and physical when a patient comes through the door. You want clear diagnoses. You want to clearly evaluate for comorbidities, and that would include, in my mind, things like sleep apnea, but certainly things like psychiatric diseases, bipolar disorder, depression, anxiety. All those things are critical to evaluate for. You want to make sure that there are no interactions with other medicines the patients are on. You want to be sure that the patient understands what a serious step this is. And I think perhaps more importantly for the entire process is to realize that opiates are not the answer to pain. They're one tool in the toolbox, and we've had this problem, I think, with image in the pain community that we've related pain medicine with opiates. And one, we shouldn't do that, and two, it's just not true. We can use opiates in patients, selected patients, appropriate patients, responsible patients. We can also use a lot of other things too. So we want to put that within an entire context of treatment that might include physical therapy and injections and lots of other things, other medications, other approaches.